I'm Kristen Shaughnessy. Last time we told you the story of Olga and Georgy Masukatov and their 2-year-old son Nikos, who was born profoundly deaf. Hearing aids and even cochlear implants didn't work.
It's super hard. Your heart breaks every day.
The final hope is ABI, an auditory brainstem implant, an FDA procedure only approved for older patients. But Nikos was approved for an ABI as part of a clinical trial at NYU Langone Medical Center. As you might imagine, it's a complicated surgery that requires a big team.
We place the paddle in the appropriate location through the back of the skull here. We make a little opening about the size of my thumbnail, and we put the device into the right place, and then we activate it in the operating room, and we do recordings. They're called electrical auditory brainstem responses. So we stimulate it and we try to measure brain waves. And if that's present, that at least is a good sign that there is a pathway and the signal's getting there, and also we're in the right place.
Although they know the results for ABI are not as good as they would be if cochlear implants had worked, for Olga and Georgy, ABI means there is still some hope.
When they did the surgery and Dr. Roland came out and he said everything went great and everything went in place from the first time they put it in, because the placement should be precise. We're talking about like millimeters, like a little bit left, a little bit right, and you're not good. But like they put it in place and all three of them were like, wow, this is amazing. Wow, this is nice.
Weeks later, doctors did a sedated activation to make sure that other nerves, like those that regulate Nikos' vocal cords and blood pressure, were not thrown off when the ABI is activated.
He had a really nice stimulation today, so we're hopeful that in a few weeks when he comes in and goes live that he'll get some meaningful auditory information and then begin to use that information.
Next up, the live activation. Will Nikos respond to any of the electrodes that might help him hear? Kristen Shaughnessy, New York 1.